Aging gracefully is not as easy as it looks. You have to smooth out the wrinkles, you got to plump up all the lines, and you got to tone the flab that seems to pop up overnight everywhere.
Some people try to charm it, you know. They give their beauty challenges names like parentheses, bat wing arms, and turkey necks. Right. So today we're going to tackle one of these. It is the turkey neck that you will not see on your Thanksgiving table. It's the one right here.
Right.
Joining us this morning to explain how to get rid of the jiggly chin skin is renowned dermatologist Dr. Amy Brodsky. Good morning. Welcome back. Good to see you.
Thank you. Good to see you too.
Okay, we're excited to hear what you've got for this.
Yeah, so these are all talking about non-invasive ways, not surgical ways.
But before we get to the list, is this something genetic? Like, does everybody get this? What, you know, how do you prevent it?
Not everybody, but it's a combination of sun damage, genetics. You're born with the type of neck you have, and then as your teeth shift backwards, the neck kind of starts falling. Yeah.
Yeah, I come from a long line of turkey necks. It's just inevitable.
Definitely. And now
I'm going to just put it out there. I'm dreading it.
Now with the iPad, we're like noticing our necks more and FaceTime.
Okay.
So I always tell my patients, if you're going to get a treatment, you're not going to see a result. You have to do a lot of things to get this better. So if you're not going to do something, the first thing you can do is wear a turtleneck.
Listen, it worked for Diane Keaton.
Right.
And it's working for Fred Weintraub.
I mean, but this is, if you want to make the commitment to doing non-invasive things, then you have to see and look for results.
Yeah, right.
So
okay.
The first thing would be what we call the Nefertiti neck, which is where we put a little bit of Botox in your neck.
We thought there was a typo.
I'm shocked by that. I didn't think you could put Botox in your neck.
Yes, you can. I mean, an experienced injector can do Botox, but you have to be very careful that you make it symmetric. And this is for the muscles that turn down. So these are for your platysma bands. This is great for a woman that has a thin neck, that exercises a lot and has a lot of banding. So we put a little bit of Botox in that platysmal band, and then also in the muscles that depress around the mouth as well.
You could do that? I didn't think you could.
Yeah, so we ask you to grimace, and we'll inject right here, and then in the platysma band here. And it's not immediate gratification, but it works in about 2 weeks, and it's around the ballpark of like $500 to $800. It is not permanent. It lasts for about 3 or 4 months, and then you have to do it again. But again, it works great.
What about eating, speaking, feeling any sort of difference?
That's why you want to go to an experienced injector, because you should be able to talk normally, eat normally, and just still have an improvement in the fine definition in your neck.
Because it's about this little edge right there. Okay. Now, you said that ulth therapy is something that has been used, but it's not for everybody, and it's kind of painful.
Well, there's a lot of devices. There's ulth therapy, which is ultrasound. There is thermage, which is electro energy devices. And so all these energy devices tighten the skin. You have to do it multiple times. It can be upwards of a couple of $1,000s each treatment, and it's slow over a 6-month period.
Okay, does Botox get rid of, you know, we just saw that was kind of like more of an angle on that neck. Does Botox do that, or that just does those bands?
Just those bands.
Okay, so that's why Botox
you have different problems for different things
and
that's
why you have to do multiple modalities.
Got it.
So what's really new and exciting is Kybella, which is by Allergan. And this is where you use an injection. It's a liquid of deoxycholate, and you do multiple injections, about 10 to 15 injections. It takes about 10 or 15 minutes. And then over the course of 6 weeks, it dissolves the fat. You have to do about 2 to 4 treatments. It does cause some swelling for about a week to a little over a week, and it can be a little bit painful. And each treatment can run, you're usually using about 2 vials, so each vial is about $700, about $1,400 a treatment, but it is permanent fat reduction.
So it's about the little pocket that happens right here.
Yes, it's called submental fullness, and it's for that fat pad that's right over here that starts to fall.
And this just came out, because we were seeing stories on this everywhere.
It just got FDA approved, and it's something new that we've never been able to do before. And then even newer, which is really exciting, is cool sculpting. I know you guys have heard about cool sculpting before, which is the freezing fat, but finally we've been waiting for the handpiece that you can put on the neck, and it freezes that bulge. I mean, these are amazing results. This is 2 treatments. The difference here is that it's not a quick shot injection. It's a 1-hour freezing fat, and you have to fit in that handpiece. but it's 1 hour, typically 1 to 2 treatments. It's also—
And you get the result from the left to the
Yes.
right.
It's permanent fat reduction. It's called cryolipolysis, so you freeze the fat, and it will permanently stay gone. So, you know, which one's better? And typically this is about $800–900 a treatment, and you typically need about 2. So the important point, take-home point, is you may not be a candidate for all of them. You may be a candidate for 2 of them. So you may be able to do cool sculpting here, and then you've got a little bit fat left here, so you can do the Kybella there. And so be prepared that not everything is going to be a home run. You have to do a 360. You have to look at the whole approach.
Wow.
This is a good lesson.
Yeah.
Thank you so much.
That last before and after was kind of
Right.
epic. And the
Amazing.
one with Kybella too.
Does it hurt, by the way,
great.
that cool sculpting
Cool
on your neck?
sculpting really doesn't hurt.
hurt?
It's all
Okay.
about sitting there for an hour and to make sure it's patient selection, and whoever is putting that device on really needs to know how to put that device on right so it fits right.
Got it. Because
And-
otherwise you're not going to have that kind of result.
Exactly. So not everybody fits in the machine.
Got
Okay.
it.
Thank
Well,
you.
for more information on Dr. Amy Brodsky's practice, getting rid of your turkey neck, your bat wings, or just addressing your skin issues, head to thederm.com.